The measles virus is highly contagious. It's spread by coughing or sneezing, and it can live in the air for up to 2 hours. It's so contagious, the CDC says if one person in a room has it, 90% of the people around them will also become infected. Unless, of course, they've been vaccinated. The measles vaccine became available in 1963. But before the vaccine, the World Health Organization estimates that measles cause 2.6 million deaths worldwide every year. The measles typically starts with a high fever, and then it's followed a few days later by that awful rash. It can lead to severe ear infections, diarrhea, pneumonia, even something known as encephalitis, swelling or inflammation of the brain.
I consider it really an irony that you have one of the most contagious viruses known to man juxtaposed against one of the most effective vaccines that we have.
The MMR vaccine, which prevents measles, mumps, and rubella, is 97% effective when you've gotten both recommended doses.
We know that the measles vaccine is very effective against measles. Unfortunately, there are some children that are too young or can't get vaccinated for other reasons, and they really count on the cushion of protection provided by community vaccination.
This is known as herd immunity, and it works. In the year 2000, measles was declared eliminated in the United States. That means there were no new cases transmitted in this country for at least 12 months. By 2016, the rest of the Americas and 24 European countries had reached the same status. Though there were a small number of cases every year in these countries, it was usually due to overseas travelers, and the virus never spread far. Now, theoretically, this trend should have continued. If every child worldwide was vaccinated, measles would eventually be eradicated. So why are we seeing so many outbreaks now, especially in developed countries? A 2019 UNICEF report says lack of access, complacency, and fear of vaccines are all contributing to this problem. In developing countries, many people simply don't have access to the vaccines they need. But in high-income countries, some parents are choosing to exempt their kids from all vaccines out of fear, a fear that is not based on science. While over 90% of American children receive the recommended vaccines, the small percentage of those who don't is growing, and each person who doesn't get vaccinated becomes another potential host for the virus. Vaccination is a safe and highly effective way to prevent measles. Those who get the vaccine are protected. Those who don't risk severe, possibly even deadly complications. It's as simple as that.